woman who raised me, born in 1932, had a third-grade education. When I finished my undergraduate degree in physics from Alabama A&M University, she announced that she had women's cancer, cervical cancer, and that she would rather die than experience the side effects of chemotherapy and radiation. The summer after I got my bachelor's degree, focused on lasers and optics, I had these plans to revolutionize the way we receive cable and internet. And this woman tells me that she would rather die than experience the side effects of chemotherapy and radiation. I was her primary caregiver during the last 3 months of her life, and I saw firsthand the horrors of cancer. I had the idea that if we can see if a dime is face up or face down from a satellite in outer space, and if I can call you on your cell phone and just your phone rings and not the entire room, why can't we use that same type of technology to develop a localized treatment for cancer that doesn't have the side effects of chemotherapy and radiation? So then I became this little black girl from St. Louis with this vision of trying to disrupt the pharmaceutical industry's plan to continue to treat cancer and then send people home to die. So I specifically am targeting those difficult to treat cancers that the pharmaceutical companies say we can't help you. So 3 months after my aunt passed, my uncle who raised me went through the treatments. He was diagnosed and he went through the treatments. I was his primary caregiver, and I got to see firsthand the devastation of chemotherapy and radiation, those horrors of seeing his skin look burned, of his fingernails turning black, of him losing his hair and his eyelashes and his eyebrows. And I said, there has to be a better way. Yes. This should be unacceptable to more than me. So I set off on this journey, applied to University of Alabama at Birmingham. I already had full scholarships from Alabama A&M, went to UAB on a full scholarship, and I set out on this mission to develop a treatment for cancer using lasers, and I started incorporating nanoparticles, and I saw that there were other people who were doing this and pioneers in the field, and I give much respect to them, but in the process of learning this new language and treating physics and cancer therapies and chemotherapies as if it were Japanese or Spanish or Chinese, and I literally learned a new language, and I found the places where there were holes in the science. And I said, this doesn't make sense. Why are they doing it like this? And I'd spent 3-4 years digging in, and there was